Welcome to the Purr Podcast, your favorite feline-focused podcast, where we dive into all things feline, medicine, surgery, behavior, and of course, a sprinkle of veterinary gossip along the way.
I'm Dr. Jolle Kirpensteijn, feline fanatic, surgery nerd, and self-proclaimed lover of all things awkwardly cat-related.
And I'm Dr. Susan Little, proud cat vet, podcast enthusiast, and your guide to the wonderfully weird world of feline medicine. Let's get started.
Hi, this is Dr. Susan Little.
And this is Dr. Kelly St. Denis sitting in for Dr. Jolle Kirpensteijn.
Oh, that was great. I thought we both had really, that they were like enthusiastic.
Yes, yeah.
The timing was good.
Yeah, we're getting it down.
I think we do better than Yola. We don't need Yola. We really
Poor
don't.
Yola.
Poor Yola.
Hopefully he's not listening to this.
Well, this is the Purr Podcast, and regular listeners will discover that Yola is not with us this time. He's off doing other things. And so Dr. Kelly St. Denis, who is often a co-host with us, is sitting in with me, and we've been let loose. Who knows what will happen?
Yeah,
Anything could happen,
Yep.
right? So we have a very special guest today, Dr. Lisa Restine. I'm pronouncing your name right, I hope.
Yes.
Yay! So introduce yourself, please.
Well, I'm Dr. Lisa Restine. I'm a feline veterinarian, and after spending about 9 years in feline practice and a little bit of time in the ER, I now work for Hill's Pet Nutrition as the feline content expert.
So we do want to talk about that because I think that's really innovative. Where did you go to vet school?
I went to Western University of Health Sciences in Southern California.
And how was that?
It was amazing. I'm a Jersey girl, so that was my experience of leaving my tiny state into the big state of California.
Ah, sounds like a lot of fun.
Wow. Do they have a distributive model? I can't remember how they work.
Yes,
Okay.
it's problem-based learning.
Yeah.
And our third and fourth year is at external clinics.
Right.
So it may have changed in the 10 years since I've been there, but
Yeah, okay.
I felt that the hands-on experience and the way that I learned and being able to choose where I did my externships was really key to, driving me into the feline world.
Wow.
You have an undergrad before that too, right?
Yes,
That I
yes.
noticed. I did search you up on the internet, as I try to do with our guests if I can. But I found that interesting too. Do you want to tell us a little bit about that?
I graduated from Rutgers University in New Jersey.
Rutgers.
Mm-hmm.
Okay.
Yeah, it's they have a very, very good animal science program. So of course, me being the young kid, I was like, I'm not going to our state school. I want to go to some fancy college. And once I saw that, yes, they are in fact very good for what I was looking for. I got a great education there. Lots of, again, hands-on experience with all sorts of animals. And
That was your goal then. You wanted to get into veterinary medicine?
I was a weird 12-year-old that figured out what they wanted to do
Yeah.
in 5th grade.
From the beginning.
Mm-hmm. Mm-hmm.
Yeah.
And then, sure you do, yeah. You got to be good at math and science. Of course you want to be a vet, and many young children feel that way, but some of us actually take the science courses and,
Absolutely. Yeah. So how do you go from Rutgers to California?
So New Jersey at the time, now they do, so awesome, they did not have a vet school. So there was no in-state admission. So to get in from out of state, it's kind of being in the top 5% of all of the out-of-state applicants. And Rutgers, as amazing as a program is very difficult, and so my GPA was not as competitive, and Western University didn't bias based on where you lived. So I had the same chance as anyone in the country instead of, only having to be in that top 5%.
Okay.
And the doctor that read my application actually knew the Rutgers program and knew that how the GPA reflected and that it may not have been as truthful. So it was a really good connection.
Oh, that's good, yeah.
Yeah, that is good.
Mm-hmm.
That is good. Yeah. And so after vet school, where did you go?
So I did a mentorship program in a cat hospital in San Antonio. So that's where I spent a lot of my time after that as well.
So who was that through?
Dr. Gary Norsworthy.
Oh, yeah. So it's something that Gary set up.
Yes.
Okay.
I did an externship there my 4th year.
Okay.
And he was hiring at the time. And after spending a couple weeks there, he offered me a position. And I said, I'm not moving to Texas. As California was far away, I had plans to go back to New Jersey. But the hospital's a really unique place, and they do a lot of really good cat work, and he's really involved in research, and as a new grad it was a really good place, and he took on a pretty thorough mentorship program for that first 2 years, and I stayed a lot longer.
That's nice, yeah, to have that opportunity right out of school.
Yes.
The mentorship, so many people
I didn't know
get
he
value.
did that.
Yeah, no, neither did I.
I don't think I know of other clinics that do that. It's a great idea.
Yeah, he spent a lot of hours after we were done working, just kind of going through his lectures, because he's retired from speaking now, but was a very proficient speaker, so we got one-on-one.
I'm impressed. I think you're very lucky because, of course, I've known Gary for a long time, and I always have great respect for Gary and Kelly. I don't know you'll appreciate this because of your editing for the Journal of Feline Medicine and Surgery. Gary has published some almost groundbreaking studies from private practice.
Yeah, which is amazing.
And we don't see that very much.
Nope.
No. Do you see in your submissions to the journal, or are you seeing any more that come, or they're mostly universities?
They're mostly at academic institutions, yeah. Although we do have a few. Yeah.
Yeah, so I always had great respect for Gary because you can influence change in a good way from private practice.
Yes.
Yeah.
And he's a very good example of that.
Is he ever? I use some of his studies quite often, so I don't know if his ears ever burn. It's because somewhere I'm somewhere I'm talking about something, and I think you have your name on at least one of the papers with him or more, I think.
Yes, we did.
I recognized your name.
The second GI went with the 300 cases.
Yes.
And I did the loose control study that we published as well.
So that's one of the ones, the one we're talking about. So Gary and colleagues looked at diabetic cats who were managed with this kind of loose control system that he uses, and I thought that was groundbreaking. I really did. And the reason I did is because if you're an old enough practitioner, that's what we did. It just didn't have a name, right? So it's just less intensive.
High intensity came in, and everybody got excited.
So that's actually what we did, right? And so for Gary to actually have a caseload and publish out of it, and with amazing results, right? I felt like, we've been heard. Thank you. Thank you.
And that really addresses some of the accessibility or accessible care issues that we have now, where we always talk about gold standard, and that's such a, everything has to be done this way, but accessibility for caregivers is trying to work with them and how they want to manage their diabetic cat. So
absolutely.
It's nice to have
I think that's a huge issue right now, right? Like,
absolutely.
That diabetes paper is a good example of how there's more than one way to do things.
Yes, and that's something I'm finding a lot at Hills. People are asking, what's the best way to do this? And there is no best way. We're not treating a disease, we're treating a cat and a cat parent. And that is,
for you.
Something
a really good view.
Good for you.
So at what point in your time with Gary did you decide you wanted to do ABVP?
It was, I don't want to say a requirement, but it was strongly encouraged from him, and he provided all of the support. I was really lucky had to have Bill Folger as a mentor. And
my gosh! Wow, you had the A team.
So as soon as that 5-year point came around, I was prepared, and doing that diabetes paper was part of that ABVP. To be first author took away one of the case reports, which
which is always good.
Yes,
that's a heck of a case report.
Yeah. So I was able to use that and then only have to do one full case report. And
wow.
And I was the COVID class of ABVP, so I got to take my exam in my pajamas in my home office.
You did. Oh my gosh, I didn't think of
I
that.
remember that horror stress of a day and a half
Yeah.
somewhere in a giant room with
I-
hundreds of other people.
So I'll tell you my exam story. So it was in Chicago when the first time that I wrote the exam, and so we were all staying at one hotel, and then they put you on a bus, and they take you to this public space that's all like classroom set up, right? And there was a girl on the bus beside me who I think she's doing bovine, maybe. And so we chatted on the bus, right? And then we get in the room, and they always make sure that you're never beside somebody who's doing the same specialty as you, right? So she was like directly ahead of me. And then the moment came where like you open your papers and you get started. And within like a few minutes, she caught my eye because she just went her head down on the table and just went like that. And I thought, it's not a great start. This isn't good. Yeah. So it's a stressful event.
It was.
I'm sure it was stressful at home too.
Yeah, not even knowing if we could
pajamas.
take the exam, because they didn't have any of that set up.
Yeah.
It was
Yeah.
all trying to
Right,
catch
right.
up, and
That's a big change to do it virtually.
it went. For not having ever done it before, it was very as smooth as you can imagine.
That's good.
And
That's good. And then you have to wait.
You try not to think about it for 3 months and hope that you pass. And
It's very true. I just realized we have 3 ABV, feline ABV,
Yeah.
ABVP specialists chatting together, and for our podcast, this has never happened before.
No.
So I think it's appropriate because we are actually recording this at the AAFP conference in Minneapolis, and it's the 50th anniversary of AAFP. The alphabet is tripping me.
we don't. It's now the feline VMA, so now we don't have to say that.
Yes, that's true. We literally earlier today were looking at the change from
Some rebranding.
Mm-hmm. Yeah,
Keeping
absolutely.
felines first was kind of their talk this morning.
Okay.
Oh,
yeah.
I like that.
Yeah.
I like that. So, are you involved with AFP at all?
Just trying to help strengthen the connection, but I think I've only been in my current position for almost a year, so there's definitely room for more.
Yeah. So, what made you leave private practice?
It was burnout, really. It was really just emotionally draining. I switched from feline only, and I did a little bit of my own feline, but I also worked ER on the species we don't discuss,
Yes.
and cats.
The lesser species,
the
I call
lesser
it.
species.
Yeah, it was, and it was a really great experience to be able to bring my cat knowledge to a specialty center that didn't have a lot of good cat protocols in place.
Right.
But ER is a great place for burning out, and since I kind of started for a change, I wanted to take a little bit of a break from private practice.
Yeah, that's fair.
Yeah.
I think a lot of people do that. And we were talking about this earlier, how it's nice. Our career is such a versatile career, right? You can do different things. It's not just general practice. You can become a specialist. You can work in industry. You can always go back and do something in practice again. So
There's no way.
become an editor of a journal. Like, there's just so much
There
to
you
do,
go.
right?
Yeah,
it's
yeah.
just a lot of variety.
There's
So,
a lot of ways to be a vet.
Yeah.
Yeah.
So we need a break. I did the same thing. I took like 8 months off of practice when I moved recently and just stopped practicing for a while for the same reason. It's just exhausting sometimes.
Yeah, I want to be able to give the best of myself to my patients and my clients, and I felt like I couldn't even give that to myself.
Yeah.
So, it's I know I'm not staying out of practice forever. There's no way. That's where the real passion is,
But that's really good self-awareness,
Yes.
right? Like if you're struggling, you can't do your best for patients and their owners, right?
Yes.
And I think it's not everybody comes to that sort of self-awareness point where like if you don't take care of yourself, you really can't do good work, right?
Absolutely.
Yeah. So what made the change from Gary's practice to ER?
It was just, we had a little bit of a difference in how we felt practice should be, and there was a lot of, I was full-time and I was the only full-time, and it was just a lot of pressure without, having that ability to make some of those changes, and I just wanted something different.
Yep.
And having that ability in the ER to also be the feline specialist and do some cat appointments, and it seemed like a really good change, and I wanted to see what a totally different hospital was like. You learn so much. And
I think that's happening a lot lately because shortage of vets in many parts of Canada and the U.S. So like you can end up being, you don't have a full team to work with, right? And it's a lot of pressure. And Kelly and I were chatting earlier about how slow change is.
Yeah. Yeah.
Right?
To make change and
Yes.
to actually see all the fruit of your labor
Right.
is challenging. Yeah. So if you went into that setting, it was probably difficult because people in ER are not necessarily going to be focused on cat friendly or even focused on cat medicine in a specific way, right?
Yeah, it was, I kind of was so surprised at how little that, of what I thought was kind of basic cat friendly techniques that were being utilized. But I feel like at least I left my mark, and hopefully they're still doing some of those things.
Yeah, I
Slow
think
change.
ERs are one of the places where it's taking longer to get cat friendly principles in there, and they are a unique environment. Right? And that it brings its own challenges, I think.
Yes, yeah.
Yeah, for sure. Yeah. And it is even just within a practice, like within Gary Norsworthy's practice, so I'm a practice owner, and I was telling Kelly earlier that I would come back from meetings, right, and have all these great ideas. And actually, my staff feared me coming in the door after, because she's where we're meeting, and there's 50 new things, right? But that doesn't work, right? And even as a practice owner, when you come back with these ideas, it still has to fit into your hospital, your people, your needs. Like maybe buying a new X-ray comes before, so.
Yes. Yeah, I used to try to pick up one or two pearls that I thought really could apply to the hospital.
See, you're smarter than me. Yeah, you're smarter than me. That's the way to do it.
The first time it was definitely all 50 things, but after being told this is not possible, I tried to only have a couple.
Yeah. Yeah, that's the way. And, yeah.
Sometimes those small suggestions make huge changes.
Yes.
Yeah,
Especially
absolutely.
with cat-friendly stuff, I found. Little things make a big difference. So,
They
and
really
then they
do.
get buy-in. When you bring something like that, you get buy-in from
Yeah.
everyone when they see it succeed.
Yeah.
So
Yep.
then you can pull the other 50 out of your cat. Let's go on to the next one.
One by one. One by one,
Yeah,
So,
let's do this.
yeah. And Kelly was lucky because you were essentially a solo practitioner for a long time. Not by choice, but yeah.
I had an associate a couple days a week for a little while, but mostly it was myself, so I could do everything. And I could come back from the conferences, and if I wanted to change things, but you still have a veterinary team that you have to make sure everybody's on board, your technicians, your assistants, and your section.
Absolutely.
Yeah.
Right.
So.
Right. And it's hard to come back with, okay, we have to gut this exam room and
Yes.
change is tough.
Change is tough.
Yeah.
Yeah.
So how did you come across the position at Hills? How did that?
It's kind of an interesting thought where I didn't realize how, I won't say miserable, but uncomfortable I was in the ER position until my husband, he's in the tech world, and post-COVID, there's just been multiple layoffs. And so his company was like, hey, your team is dissolving, we don't have a position for you anymore. They all overhired during COVID. And,
of course.
And so once my job went from I'm doing what I love to I have to work, I was like, I don't like this. And it was just instant. And
Different context.
I went on, I think one of the job search sites, and I just looked up feline industry, and I saw a position with Hills that wanted a feline ABVP boarded with experience in lecturing, and I was like, I fit these credentials. I guess I'll throw my name in the hat, and I imagine there probably weren't too many feline specialists, so.
Because that's a pretty, that set of requirements,
It was a very unique set of requirements that I was like, wow, I
You must have
fit
been,
this.
that's me.
And Jolle is actually the person in charge of my team, so I'm sure he saw it and said, oh, wow, this actually meets what we
Look
need.
at that.
Yeah.
So,
But have you had to relocate or
yes.
your job?
So we moved out of Texas now we're just outside of Kansas City in a suburb.
So how do you like living in the Midwest?
I love it.
Oh, good.
I never will be a Texan. It was too hot, and it just does not, wasn't what I was used to versus both New Jersey and California, but Kansas feels like home with the seasons, and it just kind of reminds me a little bit of where I grew up.
Oh, that's great.
The tornadoes.
Tornadoes.
We have a basement, and I'm learning to not panic every time the radio goes off.
Yeah. Yeah. Where in New Jersey did you grow up?
It's a pretty small farm town. So it's Monroe Township. It's kind of the dead center of New Jersey.
Yeah.
And a bunch of cornfields and
Yeah.
so.
Oh, that's very cool.
Nice. Yeah.
That's very cool. So you've been in your new position less than a year,
Mhm.
right? So what do you do?
It is evolving, but I think the elevator pitch would be I'm really focused on both internal and external education and just providing resources both for our team members but also for veterinarians and veterinary staff and cat parents, and just trying to educate as much as I can on anything. And I'm very clear that I am not a nutritionist, so it's coming from a feline practitioner standpoint.
You know, I love that part of your job is internal facing.
Mm-hmm.
You know, that's really important. I'm not sure how many companies do that. Right?
And I mean, Hills is primarily known as a dog company, and it's a lot of the team members like never even have pet a cat. They're just, you know, so I organized an internal day where I brought my cats in and just had people come and just spend time with them, you know.
Oh,
just
that is
to
so
kinda
cool.
Understand feline behavior.
That is so cool.
That's really neat. Yeah.
Yeah, it's nice to be able to try to make some feline positive change on the inside. So, yeah, I think that's really cool. And so, give us an example of what you've been doing. Are you working on any projects that you can talk about, or?
Well, I think you know one of the big projects.
I know one of them. Yes.
But I did, I gathered a really amazing group of feline practitioners, and we created a cat advisory team. We're meeting next month after the Hills Global Symposium to kind of talk about some issues in feline medicine and maybe come up with some statements about how to feed the cat, both nutrition and behavior and things like that. So.
So that's a big subject,
Yes.
right? How to feed the cat.
Nutrition and behavior.
Yes, and we have nutritionists, we have feline people, and we have behaviorists. So we were going to have all of the points of view, and I tried to have a nice global rounding out of people from all over because it's different everywhere.
Yeah. I think if you're hopefully if you're a feline vet, you do better with your clients on nutrition because in sort of average general practice, and I'm not trying to look down on general practitioners, but it's hard for them in the amount of time they have, right, to really properly address nutrition, behavior aspects.
Yes.
There's not enough time, and it tends to get pushed to the side, I think.
100%.
Doesn't it?
Yes.
Yeah.
People are really off on their own trying to figure it out at the pet store or whatever, looking at labels and what should I feed. And sometimes I find with my cat, I've had a few second opinions come in for other things that the other veterinarian has advised that the cat's overweight, but then not given any advice.
Oh, yes.
And I had someone that had cut their cat's food back to 130 calories a day.
Oh, no.
And it was a cat that was over 15 pounds. Like it was, what? You can't lay ice into the caregiver. I'm like, okay, well, with this, we're going to stop now.
That's jaw-dropping.
But so like you said, there's not a lot of time. So they identify a problem with the cat and then don't necessarily have the time to really guide the caregiver. And I think that's something we really need to get working on.
Yes.
And I try to do it with all of our appointments that we're doing some heavy nutrition. Even in 5 minutes, we can get a lot of information.
And we say it's the
people.
fifth vital sign.
It is the fifth vital sign. Yep.
So.
Yeah.
Yeah, I think, but there is a struggle, right? And I think we have to recognize that just like talking to vets and lecturing to vets and saying like you must do this in your appointment, WSAVA Global Nutrition does a good job too, but it doesn't give the vet any more time. So thinking outside the box, I think, is going to be a key component of this.
Yes,
right?
I mean, one of the talks I like to give is how to incorporate that mini nutritional assessment in every exam, and how many pieces you're actually already doing, and you just have to kind of think about it differently, so it's not extra time, just a couple extra brain cells that you might not exercise as often.
Yeah, that's very true, because you're doing a lot of it, you just haven't called it a nutritional assessment, right?
Yeah, we've adapted a nutrition questionnaire that
Yes.
it's a PDF, fillable PDF that I still have to get our team start sending out before appointments, but they're supposed to send it out beforehand. Now that still doesn't get the vet more time because that means you have to read something. But it means that when that person's there, they already know what food they're feeding. Like how many times
The
do you
red
see
bag.
people going, yes, the red bag, you know, the one on the left aisle at the whatever store. Yeah, so that kind of takes a lot of that away too.
So I created a form like that years ago. After just getting too many, it's the yellow bag with the cat on it, right?
I know that one.
The one with the
Right?
letters.
Yeah, and people like magically forget the name of the food, and I probably would too.
Pressure.
It's the pressure, and sometimes the person who comes with the cat to the appointment is actually not the person who feeds the cat.
Yes.
So there's all kinds of ways this scenario can go wrong. So we created a fillable form. It's online, and our clients get a link to it with their appointment confirmation. And of course, not everybody fills it out, right? But
Yeah.
when they do, you get better data.
It's
Yes.
more helpful.
You get better data. So I think like things like that can help us, right? Like collect the data. But then we also have to deliver the information to the owner. So
Yes, and I know the WSAVA has some really, really good references, and that's what I encourage a lot of people to check out now. And then, hopefully we'll work on creating more from where we are too. So
Yeah.
keep an eye out for that.
yeah, well, that's a good point, I think, to end our episode. And fortunately, Dr. Restine will be back with us for a second episode. So stay tuned for that. We'll leave a little bit on a cliffhanger of using the World Small Animal Vet Association tools. I think that's a good cliffhanger to end on.
This is the Purr Podcast, where we talk cats, laugh a lot, and learn something new every episode. Together, we bring you the latest updates, surprising cases, expert interviews, and just a touch of chaos, because nothing with cats ever goes as planned.
So whether you're a seasoned veterinary pro, a new grad, or you're just here for the cat puns, you've come to the right place.